Disclaimer: the views and opinions expressed by the guests and hosts of this show are their own and do not necessarily reflect the views or opinions of the company or the show itself.
Good day, Explora bookworms. Welcome back to Explora Talks. Here at Explora Talks, we dive deep into books and the incredible authors behind them. My name is Maggie, your host for today's episode, and I am excited to share another inspiring story with you today. At Explora Books, we're passionate about bringing meaningful stories into the world. Stories that inform, heal, and most importantly, inspire. Whether through publishing or amplifying voices that matter, our goal is to connect readers everywhere with stories that make an impact. And today, we're doing just that. On this episode, I'm excited to speak with an author whose work connects dental science, public health, and patient empowerment. He is a dental public health specialist and educator on a mission to make dental care easier to understand for everyone. Ladies and gentlemen, the author of The Understanding the Dentist, welcome to Explora Talks, Dr. Ishmael Bruce. Hello, Ishmael. How are you doing?
Fine, thank you. I'm
Great.
all right.
You're all right. You're excited to share us your inputs and about your books and your knowledge about dentistry for today. So I'm just going to go ahead and ask you right away. First, I wanted to learn more about you. What inspired you to write Understanding the Dentist?
Yeah. It all started in dental school. I came from Ghana on scholarship, did dentistry here at the house in Halifax in Canada. In dental school, I knew I wanted to teach. Yeah. So I did public health, a specialty in public health. Yeah. And I thought that I had written a first book, and it did well, not financially, but did well in educating people. So I thought in dentistry especially. And all throughout my life, even in Canada here, I found that people didn't know that much about dentistry. A little bit more about medicine. Like if you went to the doctor's office, there are some leaflets, booklets, but on medicine mostly. I never saw any on dentistry except something like the Reader's Digest. Maybe it has a little snippet on dentistry. Yeah. So that was the reason why I wanted to write this book, and I knew that I could write it. At my level, I should be able. If anyone can write something to educate the people, I should be able to do it. Yeah. So that's what I started. And then the last one is the fact that people, there has been a write-up. I read it somewhere that people don't know very much about dentistry, period. They just didn't know. And if they didn't know, dental health suffers. Yeah, so I thought I should provide the information for people so that they can take care of their teeth. And it's not just the teeth. I mean, then now we find out that, in fact, the teeth are so important. The mouth is so important. It takes care of all the other parts of the body. So I thought, yes, I should be able to do something like that and educate the people. So it's for everybody, and for dental students, and for even dentists. Yeah, and that's where I started from. Yeah.
That's really interesting because I, for once, growing up, especially here in the Philippines, it was really never a big importance to take care of your teeth.
That's
In
right.
fact, in most places that I have visited, taking care of your mouth in general, especially your teeth, is so underrated. And
That's
it
right.
feels like a luxury. And so discussing this with you makes it less intimidating for people. And creating this book would actually help understand better about the importance. Like it is equally important to take care of our teeth. So who did you really have in mind when you were writing this? was this for you? You mentioned earlier it was for everybody, but were there any specific moment where you thought, I'll try to I'll write about this because I've found out that patients are not so open about taking care of their dental hygiene.
Right. Actually, I started from Ghana.
Okay.
After dental school, I went back home and taught at the dental school, a new dental school, the first one in the country. And I realized that even though teeth matter very much in that country, not very many people take care of the teeth. Because in Ghana, before you eat, your parents will let you chew sticks, chewing sticks. So we knew it was very important. And I knew that, but people didn't know. They didn't have the information and the wherewithal to actually take care of their teeth. So that's where I started, okay, I got to get this book here. I also wanted to make sure that the Ghanaians can understand it. So I read it, yes, very lightly, not very heavy. And every time there was any big, a big word somewhere, I would explain it. So you don't have to look in the dictionary. Yeah. So it was mostly for people back home. And then I found that here, when I started teaching here in Winnipeg at the University of Manitoba, I found that, we still need a lot. Even here, in fact, even here in Canada, I needed to educate people because I was working in all especially in the schools and the kids. And I found that I really had to, education was so important. It's still very important. In fact, even now, still very important. So yeah, I wrote it in fact, for students, for everyone really, and dentists as well. Yeah.
That's really beautiful. It makes me feel like the book that you are creating seems like a bridge
Right.
to the
Right.
world of dentistry and the practicality behind it, knowing
Hmm.
that me personally, I am very keen with my digestive system, and mouth is
Hmm.
part of the digestive system. And if you're not just going to take care of that,
That's right.
then technically it's pointless
That's
to
right.
understand what you're eating if you're not taking care of your mouth. So I
Yeah.
really, really love your book. And now we're talking about your book. I'd like to ask, what is the biggest misconception patients have about dentists?
You know, I've heard this so many times that it's incredible. I mean, I hate dentists. That's the first thing you hear from everybody. I mean, it's incredible. I hate dentists. But then they'll go around and say, "Oh, Dr. Bruce, it's not you." You know, "Oh, they hate dentists, but it's not me." And yet I'm a dentist. Excuse me. Yeah. So I found out that, and people said, they also say it hurts all the time. It hurts. And I'm telling you, I mean, I'm not, let's see, technically, I'm not 100% great. But when it comes to the chair side, talk to patients, I think I'm superb. I know that myself. Yes. Yes. So I try to, try and help them out mentally, so that, they can undertake the treatment. Uh, I don't know why. I really don't know why I was that interested in it. But I would take all the time to explain what I'm going to do. And this is where this book comes in. Yeah. And parents will come in and they'll come inside in the clinic, inside the operatory, and say, "Oh, my kid is so scared. So please." And hey, look, I say, "Look, there's nothing to it." And in my practice, there was nothing to it. I mean, really, yes. So that's the main thing that used to bother me, that they don't like dentists. You know, they don't really mean it. They don't really mean that they don't like dentists, They're just telling you that they are afraid, and that's why I understood. Yeah, I mean, if someone will come to the chair, especially the men. The man will come and say, "Look, hey, we're not going to hurt each other, are we?" And I said, "We're not going to hurt each other." That's right. Yeah. But eventually they find out, hey, there's nothing to it. When they get out and go to the reception on the way out, some inquisitive patient sitting there is going to say, "How was it? How was it? How was it?" And say, "Oh, it didn't even hurt." I enjoy that. Yeah, I enjoy that. Yeah.
It's
Oh,
really
yes.
interesting that it's so fascinating for me that when I was growing up, I heard so many different scary stories about going to the dentist.
That's right.
Um, and so when I had my first experience of getting my molar removed, I thought it was very painful. But the
Mhm.
fact was, paying it was even more painful than experiencing
Exactly,
because it was
exactly.
expensive.
Oh yes, oh yes. That's right.
But
That's
I
right.
always tell my people, my friends that it's better to invest on this rather than making it worse. So
Mhm.
I'm I'm
Mhm.
I'm I'm really a an advocate for like taking care of your teeth because it's important. And so
And something that I heard about dentists, being I don't know whether it's true or not, but that we're more mentally afflicted than than most uh, professions in the country. I mean, in the world, really. That dentists have these mental problems because of because of what they put us through, because of what we hear from patients. And you're working on someone so close to you, and you know that it bothers them to some extent. And mentally it bothers you, the dentist, because yeah, you're trying to make sure that everything is nice and comfortable. But the person that you're looking at his face and they're grimacing, and yeah, it makes it very difficult, for the dentist. Yeah. Uh, so anyway, for me anyway, I try to be as painless, honestly, as possible. That's right. Yeah. And it worked. I think it worked. I think it worked. Yeah. Yeah.
that sounds beautiful. My next question to you about the book is, why do you think many patients feel intimidated or afraid to ask questions?
Okay. See, I've just noticed that uh, generally doctors don't like to be told certain things at all. That's right. I mean, they come in and okay, they say, you are the expert, you know, so you do it, yeah. And I'm saying, I mean, I may be the expert, but actually, you are the one who has to do all that work, to make things work better for us. That's right. So I don't know. It's uh, something that oh, the patients even now, even now, even though they know, hey, we've got so many different equipment, different things that make things a little nicer, a little less painful. Yeah, people still don't believe it. People still don't believe it. Uh, I I don't know, but I worked a lot in the Indian communities too, in Winnipeg, Manitoba. That's right. Yeah. And I found that, hey, all you got to do is try to take it easy with them, explain things with them, uh, and they come back, which is rather interesting. They'll come back if they find out, hey, this is not all that bad. It's not all that bad. Yeah. And then I think partly though, so far as I mean, a father will bring the kid into the clinic in the room, and the kid is sitting there, everything is fine, and then dad would say, Oh, Mary, let's say the child is, Mary, Dr. Bruce isn't going to hurt you. He's not going to hurt you at all, okay? He's only going to give you a little bit of a needle. These things, they really bothered me because I didn't use certain words in my vocabulary at the clinic. I never say I'm going to freeze your teeth. I never said I'll use a needle. Yeah, I might just say, Mary, oh, I just want to, I'm going to wash your teeth, okay, and then we'll spit it out, and then I wash it a little bit more, and we'll spit it out, and you find that I'm putting a little pressure here. Can you feel the pressure? And I'm freezing. By the time I'm finished talking, I've frozen it already. See what I mean? So that's right. So I think parents were even a little more trouble than, in fact, than the kids themselves. Oh yes, and I had a system that parents don't come to the clinic with the children. No, if the child comes in and I find that the child will behave with the parents in there, yes, I'll stop and get the parents in there to help out. But if I find that the child isn't, if the child is not cooperating, there's no point having the parents in there anyway. Yeah. So we work together. They may not like it very much, but they found that gradually, slowly, nicely, you do things together with the family. Yeah.
That's beautiful. That's a very personal and compassionate approach to your patients, and that what makes this really book special and intriguing for everyone to read. Now, you mentioned about terms. You'd mentioned about you're very picky with the words that you use with your patients, which leads me to my next question. You simplified technical terms in your book. Why is that so important in healthcare?
Because I find that I'm reading things, and sometimes I have to look. These days, hey, we've got Google and all that, so everybody's looking at Google, referring to Google and stuff. But I'm reading, and I find that I interrupt myself. I have to stop and check things out.
Right.
Yeah, that's right. So because of that, I thought, no. If I want people to understand what I'm writing, not just the sentences, but the words. The words I have to make sure that the words are very, very down so that everyone can understand. And I've taught kids in schools a lot. I've done that a lot. And these kids, that's what you got to do. You got to, the term that you use, you have to bring it all the way down, so that things like gingivitis, big words like this, periodontitis, you got to go read down and say, the gum, that skin that around the teeth, that's the gingiva. You got to explain all the way down so that they get it. Parents come in and they want wisdom teeth, and there are some teeth that they're not even wisdom teeth; they're just molar teeth. So you have to. That's right. Wisdom teeth are molar teeth too, but they're not. That's right. So I'll say no. This is a wisdom tooth. And the wisdom tooth comes in at a certain time, and the reason why they call it wisdom, is at least we know that when you get it, only comes from about age 19 going. When you are supposed to be a little wiser, supposed to be anyways. Yeah, that's right. Yeah. So no, the thing is, once you take the time to explain, take the time to explain the words, not just even the English words, but the Latin as well, because a lot of the bases came from Latin. That's right. So no, I like to do it because so that you pick right now anyone who picks the book up, if you are from mid class, what do you call it, not even high school grade. The way this book is now, even the grade 10 on, 9 on, they should be able to understand what's going down. So that's the reason why, I wanted to bring it down so that we all understand. Yes, yes.
This book is really for everyone on different ages because they will
Right,
be able to
right.
understand the book, and it's not going to be intimidating for them. That's very beautiful. And we're talking about the book, Understanding the Dentist, is available on Amazon and Barnes. Dr. Ishmael Bruce, please invite our audience to grab a copy of your book and share why it matters to you.
Mhm. All right.
And as we wrap up, could you share what it's been working with Explora Books team and your overall experience collaborating with us?
Oh, it's actually been interesting. I mean, the way, even the cover, the design is so beautiful, so attractive. Yes. I'm very happy with the company that is helping me get this to the market. If in fact I'm doing the third book. That's not dental, it's something else. But I'll let this company actually help me out as well. Yeah, because I just found out that they made things a lot easier for me. Yeah. Um, and it's funny. I was telling them the other day that if anyone contacted me and was writing something, I mean, no matter what the subject is, if they let me know, this is the company should be, that should do it. Yeah, because in fact, they call me almost every day. I mean, really, it's fantastic. Yeah, I really, really enjoyed it. Yeah, and I'm not finished yet. Thank God. I think I have maybe one or two other things to write. So that's right. And I was impressed when someone said, "Oh, it's an Amazon." I mean, hey, look at this. I got my name on Amazon. Are you kidding me? Yes, it's actually quite fantastic. Yeah. Amazon, what, chapter, I think, yeah. And hopefully, some people actually tell me to go to China for a book show. That's right. I'm thinking about it, yes, but I've never been there, so it would be nice for you even to go and do the book show. Yeah, but no, the experience has been fantastic, really, with the company that's doing the book. Yeah. Oh, I
Thank
actually
you.
really, really thank you very much too, and everyone who's listening to this, please check it out. Go around. Anytime you want something, just you can give me a call. If you don't know how, you can go to Amazon and stuff. But if not, and we're close, just let me know. I'll send you a copy. Of course, you buy it. That's one thing. That's right.
Thank you.
Okay.
Thank you so much,
Thank you.
Ishmael. And I'd like to ask one more question. This is very important before we
Mhm.
conclude this chat. If someone is scared of going to the dentist, what would you tell them?
Okay. Okay. First thing, they come in, we take you to the clinic, to the operatory, to the surgery, we call it. And the first thing, I'll tell them my name, and I'll get your name. And because I find that people are, more scared of dentistry than they should be. So one of the first things that I discuss with them is um, what your experience has been. What's happened to you in the past, say, year or so. How has it been? And very often people, it's funny, patients will tell you almost every time something they've experienced prior, before coming to you. They're always saying, "Oh, my past dentist was terrible. Oh, he took my tooth without even freezing it." I mean, are you really? So I'll tell you for sure, I'm not going to take your tooth without freezing it. And I'm not even going to freeze it. I just wash your teeth. That's right. We'll wash your teeth. wait and make sure it's good. And anytime, and I know for goodness, anytime I'm working at any point in time, if you find that something is bothering you a little bit, you let me know. I'll quit it and put more medicine in it, just to make sure that it's better. Yes, because I cannot work when I think that the person may be feeling something. I just can't.
Yes.
Yes. Now, I think that is so important because that's what will let them come back, in fact, if you're working, painlessly like that. But I've always done that. Yeah, I've always done it. The interpersonal relationship should be great. Yeah, that's right. So that people can come in the next time too. Yeah.
That's really beautiful. Thank you, Ishmael. Ladies and gentlemen, the author of Understanding the Dentist, Dr. Ishmael Bruce. It's been an honor having you with us, and I hope to get to know you more and chat with you next time with your next 2 books in the future. So we're hoping that I'm going to catch up again with you on our next episode. Thank you so much for your time.
Thank you very much.
Is there anything you would like to ask or add about your book?
Not really, except that, I really would like people to read it because, for example, halitosis, bad breath. I got about a whole chapter on bad breath, and what causes it and what can you do to prevent it, and I've introduced certain things. For example, okay, we call it something. Okay, one of the things that you have to eat or chew to make sure that you can remove bad breath from from the mouth, and that is one is sugarcane. You don't have sugarcane here, but they have it in the stores. And then if you can pick up a piece of sugarcane, we chew back in Africa, and as you chew it, it actually cleans the teeth. That's right. So if you buy the book, you can find that one chapter. Anything that you need to know about bad breath, you'll find it there for sure. And I intentionally made sure that I got that whole chapter just on bad breath because it's a problem. It's a problem for most people, for all of us, actually. That's right.
Thank you so much for sharing that, Ishmael. If you notice, I was so happy when you were talking about sugarcane because my parents and my grandparents, you always think about just eat the sugarcane and you will be good. And I'm so happy you brought that up because I think it's an underrated information that everyone actually didn't even realize. So thank you so much for sharing that with us, and I hope to see you next time. Goodbye for now.
Thank you very much. Really, really appreciate this.
There you have it, folks. Dr. Ishmael Bruce, author of Understanding the Dentist, reminding us that dental care isn't just clinical. It's about understanding, trust, and empowering patients with the right knowledge. The book is now available in Amazon and Barnes. See you next time on another episode of Explora Talks. This has been Mackie, your host for today. Until next time, goodbye.